Welcome to this special webinar organized and hosted by the Royal Society of Canada. My name is Ian Wilson, and for about 10 years I had the privilege of serving as Canada's National Archivist and then as head of the newly amalgamated Library and Archives of Canada. I will act as your moderator for this hour. This special webinar deals with a report recently released by the Royal Society entitled Remembering as a Form of Honoring, Preserving the COVID-19 Archival Record. In the spirit of our topic, it is highly fitting for me to remind us that as I speak, I am located on the traditional and unceded territory of the Algonquin Nation. Our speakers from other parts of Canada will acknowledge their locations as well. A year ago, the Royal Society launched a COVID-19 task force to provide evidence-informed perspectives on major social challenges in response to and to help the recovery from the pandemic. Several working groups have explored aspects of this broad topic, developing policy briefings to support policymakers and communities. The intent is to start, perhaps provoke, a major national discussion about our society and how we remember. It is commonplace now to note that the pandemic has affected many, likely most, aspects of our lives, our communities, our workplaces, our educational institutions, our governments and businesses, and our families. We have lost much. And we acknowledge and thank the frontline workers who cared and worked to exhaustion in our healthcare system and in seniors' residences and care facilities, and the countless others who helped and kept our essential services functioning at no little risk to their own well-being. The full economic and human impact of the pandemic, of jobs lost and businesses closed, of families disrupted, and of government spending priorities altered will echo throughout the coming decade. Our various communities have responded and continue to do so in many meaningful ways, eloquently telling us of the resilience and the spirit to be found across this land. We must learn from this experience locally, nationally, and internationally. This cannot be forgotten. The report emphasizes that archives, libraries, and community groups need to collaborate to ensure that the experience of the pandemic is properly and comprehensively recorded using all modern technologies to reflect the many perspectives and voices of Canadian communities. This is essential and urgent, and I am pleased to note the task force listing of the wide and creative variety of initiatives across Canada seeking to gather and preserve documentation and memories of this past year. I note that the federal, provincial, territorial archives are working with their municipal counterparts to ensure, as best they can, the preservation of the official record of their institutions and governments. Libraries and archives across the country are collaborating. And I note that Library and Archives Canada alone in the past year, over 9 terabytes have been downloaded from crawls of news sites and websites, and over 750,000 tweets related to COVID-19 are currently in their collection. Much is happening, but Canada is a complex and diverse society, and all perspectives must be reflected in the documentary memory we pass to future generations. The report highlights the very limited resources available to our libraries and archives to meet this unforeseen and urgent challenge. The preservation of born digital records for the very long term is a serious and expensive additional pressure on even our largest institutions. Given the interconnected nature of modern society, this will not be the last pandemic. And just as we sought to learn from the great influenza pandemic of 1918, 1920, future generations will want to learn from us. Allow me to briefly introduce our guest panelists. Dr. Ethel Jones is a professor of history and dean of studies at St. John's College at the University of Manitoba. She studies the interactions between inequality, disease, and social movements. Dr. Kwame Mackenzie is CEO of the Wellesley Institute in Toronto. He is an international expert on the social causes of illness, suicide, and the development of effective, equitable health systems. Dr. Ian Milligan is an associate professor at the University of Waterloo. His work explores the impact of technology on historical practice. And Cheryl Prescott is the executive director of a Toronto Community Health Centre, where she strives to ensure equitable access to health services for vulnerable populations. I now call upon Dr. Essel Jones, who chaired the task force, to introduce their report.
Hi, thanks very much, Ian, for that introduction. I'm speaking today from Treaty 1 territory. The University of Manitoba campuses are located on the original lands of the Anishinaabe, Cree, Ojibwe, Dakota, and Dene people, and on the traditional homeland of the Métis Nation. Our COVID-19 task force working group on archiving research had its origins in the summer of 2020. So in summer of 2020, I was part of a Social Sciences and Humanities Research Council assessment panel for funding for COVID-related scholarly research projects. And as I was going through that, I began to wonder what would be the long-term fate of all of this research data. I read these amazing applications for a diversity of research projects and was struck by the fact that while the academic community has stepped up to contribute new insights into the pandemic, there was no guarantee that their primary research would, such as interviews, focus groups, or surveys, would ever be deposited in an archive or special collections for future use by other scholars, students, or members of the public. This led me to a number of conversations with members of the COVID-19 task force and colleagues unfolding against the backdrop of the pandemic about the nature of historical memory and the archival processes through which we seek to preserve the past. I'm a pandemic historian, and when I did my graduate work on the Great Influenza pandemic, sources on the experiences of Canadians were not that easy to find. There is no central depository, portal, or collections list for the Great Influenza pandemic. Government archival records, I discovered, were shockingly thin. And at the local level, the history of influenza, which was a pandemic largely ignored by historians until the 1980s, was fragmentary, to put it mildly. Historians are born sleuths, and many of us face such challenges in our research. But I was struck by how the absence of scholarly and public interest in the pandemic, from its aftermath through most of the 20th century, had left a hole where our pasts should have lived. I wondered whether the current pandemic would experience the same fate. Would it be the 21st century's forgotten pandemic? University of Manitoba has an archival studies graduate program and a very active archives and special collections. My colleagues Greg Back and Shelley Sweeney were immediately interested in talking about how to raise this issue of historical preservation of COVID experiences. And with Ian Milligan, who's with us here today, and Joe McCutcheon, who is the executive director of the Association of Canadian Archivists, we produced a report that both details the challenges confronting memory work and archiving groups and institutions in Canada today, and identifies key areas for action. And these involve governments, but also private groups and institutions and members of the public. We have 3 sets of key recommendations in the report, which you of course can read if you haven't already and access online. The need for greater resources and better infrastructure in the archival sector. The need to enhance our capacity for the preservation of digital records, which reflect how we live now. And methods to ensure the preservation of scholarly research, especially that governed by ethical procedures. Throughout the report, we try to highlight equity issues. As the paper states, COVID-19 presents an opportunity to preserve a rich and diverse historical record, one intended to honor all experiences and voices, and in recognition of ongoing systemic inequalities shaping the pandemic. History tends to favor the powerful, and this is true not just in the writing of history, but in the preservation of the past. Our public institutions, archives, and libraries at the national, provincial, and local levels have a duty to preserve diverse records reflective of the experiences of non-elites, and this must be done with the intent to enhance social justice and equity. There are important questions of identity, ownership, and private and community safety to consider in these processes. And that's why we recommend that the collecting of records and stories should be led where possible by communities themselves, and that greater funding should be made available at this level for community-led archives. Although marginalized communities can, of course, practice their own forms of exclusion and silencing, this doesn't lessen the importance of community involvement as a key principle. As a historian who uses archives, not an expert in the work of archives, I'd like to give a very brief Canadian archives history and discuss the question of resources. My co-author Ian will discuss the particular needs of digital preservation. Our purpose in writing this report was to start a conversation, and I hope that today my fellow panelists can help us appreciate the perspective of Black and racialized Canadians during COVID and how we can best go about ensuring that those perspectives are preserved. Federal, provincial, and municipal archives are responsible for collecting the records that their level of government produces. In Canada, though, governmental archival institutions have often collected private records. This dual approach has been referred to as total archives. Archival specialist Laura Miller has argued the essence of total archives came from an acceptance of public responsibility for the preservation of a wide range of archival materials in all media and from all sources in order to preserve society's documentary heritage. Further, these materials were to be used by and accessible to people throughout society, a principle referred to as the total utilization of archives. From the late 40s to the 1970s, the Public Archives of Canada, now Library and Archives Canada, expanded its services and holdings while dozens of new archival institutions of all types were founded by organizations and community groups throughout the country. The publication in 1975 of the report To Know Ourselves, the report of the Commission on Canadian Studies, which is referred to as the Simons Report, recommended a focus on Canadian studies and the necessity of archives to support that study. And this led to a surge in the establishment of university and college archives in the late 1970s. Beginning in the 1990s, fiscal retrenchment undermines this model of total archives. The golden age of government and private records collecting in Canadian public institutions was the 1970s, but the focus began to shift in the economic retrenchment of the 90s and thereafter. Gradually, over time, government archives at all levels, including LAC, began limiting their collection of private records in order to keep up with the overwhelming volume of incoming government records and the new proliferation of digital records. Today, government archives continue to administer public records that they held in the past, and in some few cases seek out and acquire new collections of private records. But collecting the records of their own level of government is the main priority. University archives have increasingly assumed the burden of collecting private records as other institutions have retrenched. Federal budget cuts have had a significant impact not just on our national archives, but also in support to community-based archiving initiatives. Up to $1 million yearly was lost in support to archives when LAC terminated funding for the Archival Community Digitization Program in March of 2019. In 2012, the National Archival Development Program that provided an additional $1.7 million for archives across the country was also dismantled. Certainly, LAC has not ignored the impact of these losses, and it has instituted some important programs, which I have to emphasize are carved out of a dwindling overall budget that target community level projects and Indigenous heritage, an important part of our processes of reconciliation. So this dire picture doesn't include what's been going on at the local and provincial level, which it's actually quite difficult for a report like ours to highlight all of these different jurisdictional issues. Sometimes the picture, certainly in Manitoba, would be worse. So the RSC expert panel in 2014 established this era of crisis, concerned about vanishing and undervalued natural cultural resources. Program cuts have accumulated, and the LIC's overall budget hasn't been increased since 2012. And this has had a very serious impact that has affected what where we were at as we arrive in the COVID-19 context. So our capacity to preserve COVID-19 is taxed. But many archiving institutions are doing extraordinary work despite these challenges. And here, university archives have played an important role. Our report contains a snapshot of some of these archiving projects. Archives and Special Collections at Brock University Library, for example, has been collecting records relating to COVID-19 in the Niagara region. Likewise, the University of Saskatchewan's Archives and Special Collections has joined with the Digital Research Center and a faculty member specializing in the history of medicine and public health to capture the history of the pandemic in that region. There are also important innovative collaborations that make maximized use of resources. The University of Ottawa Libraries, Archives and Special Collections, which is home to the Canadian Archive of Women in STEM and the Women's Archives collections, is collecting women's experiences of COVID in both English and French. And this is in conjunction with a larger initiative coordinated with Information and Archives Management at the University of Ottawa, the City of Ottawa Archives, and Corporate Records and Archives of Carleton University. So I don't want to suggest that these initiatives are not incredibly important and also ongoing. I think we were just able to capture what was going on at a specific moment in time. But overall, the picture for archives doesn't seem good. So the Steering Committee on Canada's Archives circulated a survey in fall of 2020 and asked its members to explain what they were able to do in an ongoing way to preserve COVID. And it concluded that little more than 4% of archives in Canada are able to muster the resources to collect COVID-19 records. If you want to see a list of ongoing community engagement and partnerships, you can see Appendix 1 in our report. And it is our hope in fulfillment of one of our recommendations that that page will continue to live on the RSC website and continue to be updated with current information on various projects on COVID preservation. So I just want to conclude very briefly by putting up our list of recommendations, specific recommendations for how we might strengthen available resources and infrastructure. And these are, of course, about, partly about starting this conversation and encouraging processes of preservation. And we hope that federal policy leadership will be available on toward this goal. But we also want the provision of a federal funding stream in order to support community-based archiving. We'd like to see targeted resources to community archives to support them in preserving issues in their own communities and provide capacity building and support and guidance for the archival sector through organizations like the LSC. And examples here are online training resources, sample forms for donation, etc. So technical supports. And finally, the one I was mentioning previously, to encourage the creation of a dedicated web-based research tool to help the public and researchers in the future locate and access pandemic records across Canada. Okay, thank you.
Thank you very much, Dr. Jones. And through you, I'd like to thank all the members of your working group for producing a powerful and cogent report highlighting the importance of archives and memory. Thank you for doing it. We turn now to Dr. H1n1 Mackenzie in Toronto. Dr. Mackenzie.
So I want to start off by explaining why I'm not going to do a land acknowledgement. I'm not doing a land acknowledgement because I'm beaming into you from Geneva in Switzerland, where I'm doing some work with the WHO. And so it's sort of slightly inappropriate to do a land acknowledgement because I'm not there. But I would want to support what Ian had said, because obviously the webinar is the RSC webinar, and attach myself to the land acknowledgement of the RSC. I'd like to thank the Royal Society Working Group for such an excellent report, and also thank people for the opportunity to speak today. And I'm going to speak a little bit about memory, because we have a problem, I think, with selective memory. Now, everybody will remember the Titanic, a huge maritime disaster in which 1,500 of the 2,250 people on board died. And the Titanic, they had a one-size-fits-all strategy, get to the lifeboats. But people with cheaper berths were on lower internal decks, and they needed more help that was missing. So 2 to 3 times as many first-class passengers survived as third-class passengers. The Titanic is used in public health teaching to make the point that in a disaster, you need a variety of responses if you're going to meet the needs of a diverse population. But we seem to forget that when we come to pandemics. So, most people remember the H1n1 pandemic, and we braced ourselves for a flu season which we thought was going to rival the big flu pandemics of old, where Dr. Jones had started her work with 1917. Now, it was generally not as bad as expected, but it was for some people. Racialized and indigenous people were much, much more likely to get H1n1, up to 10 times more likely to be infected. And there was such concern of mass deaths that specific culturally appropriate responses were set up in some provinces. We did that back then. But somehow we managed to forget that when it came to the COVID-19 response. And people are already forgetting what is happening in the COVID-19 response. Now, we all know that 70% of people who died in COVID-19 were in long-term care homes. And the Wellesley Institute, and also in a report recently from CIHI, have shown that 4,000 people would still be alive if we had protected people in long-term care as well as Germany. This slide is a lives lost analysis. It's trying to work out how many people would have been saved if each of these countries had the same response as Germany. And you can see the big blue square is United States. Wave 1, they'd have saved over 80,000 people. The United Kingdom would have saved over 35,000 people. And Canada, which is the little red, appropriately red square, will have saved 4,500 people if we had had the same response as Germany. And 80% of people in wave 1 were in long-term care, and just about 4,000 people would have been saved. So we know this, but somehow our provincial leaders managed to forget that that didn't happen by accident. We chose that path. We chose to sacrifice our elderly to protect ICU and hospital capacity. These were choices that were made, but somehow they have been forgotten. Of course, it's not just us. At the moment, the UK is spending a lot of time letting everybody know how well they have been doing in vaccination, and they have been doing a spectacular job at vaccinating the population. Half of the population of the UK has been vaccinated. But they forget that there have been 125,000 people die from COVID in the UK. And their COVID response has actually been one of the worst in the world. That history is quickly being erased. We seem to have a problem with selective memory, especially when it comes to inconvenient truths and histories of marginalized people. And that's a problem. It's a problem because inconvenient truths stop us making the same mistakes over and over again. It's remembering that allows us to forge new paths. And that's one of the reasons why I get so worried when it sounds like we are not supporting the archiving of information, of data, of memories, of stories. These are incredibly important and exceptionally and especially important in a pandemic, because when you make the same mistakes over and over again in pandemics, it costs lives. But I'll go a bit further and I'll explain what this diagram is. See, in the pandemic, I've been part of something called the Black Health Equity Working Group. And this is a group of community clinicians and academics who came together calling for socio-demographic data collection and then the analysis of that and use of it. And this group is one of the reasons why disaggregated data has been collected in Toronto and Ontario. And disaggregated data is vital because if your data, if your stories are not collected and disaggregated, you can be lost in the whole. You become invisible. And collecting these data and stories from communities has been important. It led to pressure on government to support the pandemic responses focused on hard-hit communities. It supported community organizations, community health centers, and municipalities to create culturally appropriate responses to COVID. And I hope that we may hear some more about that when Cheryl Prescott speaks later on. In Toronto, this work halved the disparities in COVID-19 and it saved lives. And what you're seeing in front of you is a graph which just shows from June to December 2020, the rate of COVID-19 compared to the white population for 4 groups in Toronto. And if you start in June and you look at the top line, which is the Latin American population of Toronto, 11 times the rate of the white population in June, 5 times the rate of the population by December. If you look at the Black population, which is the next line down, or the blue line, you'll see it peaked at 9 times the rate of the white population in August, and then it's down to 2 times the rate of the population. This is because of people on the ground working hard, focusing on those populations and trying to find real solutions to COVID for them. And as I said, I hope we'll hear more about that. But the Black Health Equity Working Group were clear that collecting data wasn't sufficient. Data has to be analysed and then used to inform policy if it's going to make a difference. And in my mind, that's the same for archiving. Archiving is useful, but making sure the archived data and stories can be used can be transformative. And I want to make one last point really quickly, but that it's similar to what Dr. Jones has said. The Black Health Equity Working Group have developed a tool called the EGAP. And EGAP is a model for data sovereignty for communities. It stands for engagement, governance, access, and protections. And this could be a model that could be used by our archives. Engaging communities ensures that the right data and stories are collected. Community governance ensures accountability and visibility. Building in community access and building community capacity to use the archive data makes sure that the data is used well and used appropriately and is used more. And protections make sure that the archived data, those stories, are not misused. So I'm suggesting three things. Equitable archiving, which includes the voices of marginalized populations, is important if we're going to build back better and learn the lessons from COVID-19. Using archived information is vital if we're going to not make the same mistakes over again. And using a community governance approach could significantly strengthen archiving. So in conclusion, we need to make sure we learn the lessons from COVID-19, and having the data and stories available is a prerequisite for that learning. So supporting and funding archiving of knowledge from COVID-19, the experience of COVID-19, I think is going to be vital for communities. Thank you.
Thank you very much, Dr. McKenzie, for those insights. Fascinating, but a little horrifying story. And your points at the end, I think, are absolutely key in terms of engagement, access, use. We can preserve, we can maintain, we can look after data in archives. The question is use, and does anyone listen? Does any government listen? And there's come to a point where not that many in government have a background in history. And they're in public admin, not history. We used to be, at the start of my career, we had a lot of historians as politicians. No longer. Anyway, thank you. We now switch over to Dr. Ian Milligan in Waterloo. Ian.
Well, thank you for that introduction, and really enjoying the conversation so far. Hi, everybody. My name is Ian Milligan. I'm speaking to you today from Waterloo, Ontario, on the traditional territory of the Neutral, Anishinaabe, and Haudenosaunee peoples. What I want to talk about today is what concerns me as a historian. What will our history of this unprecedented period look like in a quarter century? As the world is reshaped by COVID-19, as we've been talking about this afternoon, Eastern time, it's clear that this pandemic of 2020 and 2021, if I can be optimistic and put an end date on it, how will we make sense of it? In other words, a child today will be a historian of this pandemic in the future. What sources will they turn to? How will they verify scattered memories? How will people tell the story of this tumultuous times that we're living in today? And of course, the record that we leave behind a large part of it will be digital in nature. And I think we'll understand a lot of this period through digital media. We connect with loved ones via email, video conference, and social media, speaking to you all today. White-collar workers have overwhelmingly transitioned to remote working. Global protest movements have been spurred by digital communication and digitally mediated images and video. And for some of us, and I say some of us in the pandemic, the enduring image may well be a screen. And of course, much of this is mediated through social media. For example, here's what people were talking about Doug Ford a few days ago on twitter.com, where we can see conversations around the vaccine rollouts, the color-coded response framework we have, advertisements from the Canada Revenue Agency, vaccines in long-term care facilities, freezers full of vaccines, and strangely at the bottom, Doug Ford hugging a puppy. But all of this is part of how people are understanding this pandemic that we're living through today. Or in some cases, we can use web archives, in this case, collected by the Internet Archive in San Francisco, to go way back in time to a year ago when, as we're hearing about in committees in Ottawa right now, the Public Health Agency of Canada deemed that the risk to Canadians was still low. So here we are, March 9th, we can see, single-digit COVID cases still in Canada on March 9th. And if I go to the COVID updates, I can scroll down and see that sort of infamous thing we're still debating today, where the risk to Canadians was assessed as low. So important historical resources here. Now, why did I have to go to an American website to see our heritage? Some of our recommendations, because if I wanted to look at a site like that through Library and Archives Canada, unfortunately, since April, the Government of Canada Web Archive has been down. It's not available due to some of the remote work restrictions. And around the world, we see that national libraries are stepping up to collect that kind of digital heritage I just showed you all. And in countries as varied as France, Denmark, Singapore, South Korea, Australia, the United Kingdom, etc., web content all falls into the realm of legal deposit. Sort of like how if I publish a book, it ends up at Library and Archives Canada by law. In some countries, if I tweet as a Canadian, it ends up in those national libraries by law. And the United Kingdom is a great example of that. Now here in Canada, and I'm not just saying this because the former librarian and archivist of Canada is our moderator, the Library and Archives Canada Act of 2004 is a fantastic piece of legislation. It gives the National Memory Institution the power to gather, as I say here on this slide, a representative sample of the documentary material of interest to Canada that is accessible to the public without restriction through the internet or similar medium. But I think through our task force, we could argue that we're not using that to its fullest extent. That's not to say that LAC isn't doing amazing things. This is probably some now somewhat dated data where they had collected over 6 terabytes of data and over 700,000 tweets in both official languages. And of course, as was mentioned earlier, institutions around the country are digitally archiving these events, whether it's with the Canadian Association of Research Libraries or community collections like one we see here from Concordia. But I think what we see in our report is that what we're doing isn't enough. We need to do more if we're going to make sure we have this record to rise to the challenges that have been outlined in the previous 2 presentations. Part of that is because we don't really have a systematic program in Canada to recognize the importance of born digital data. When we survey people about web archiving, in these, whether it's university archives, whether it's large provincial institutions or community organizations, collecting all of that social media, collecting all those websites usually falls on the side of somebody's desk. 10% or 20% of your job to go out and find what you need to find on the web. Overwhelming amount of work. And it's being carved out of existingly, as Elsa mentioned at the beginning, budgets that are already stretched. And so we really do say we got to stop robbing Peter to pay Paul. We need funding from the Government of Canada to specifically fund this capacity across our cultural heritage sector. Then we need to empower our Library and Archives Canada, again, dedicated funding for this, so that they can preserve everything that's going on the web, at least the Canadian World Wide Web, what they can find, and retain it on sustainable Canadian digital infrastructure. We know data sovereignty matters. We need to have this data sitting in Canada, governed by our laws and with our decisions around what we will do with it. And I think we can see this role of LAC helping to coordinate the stuff that's going on across the countries. Some things are probably being collected by many, and other things are falling between these cracks. And because empowerment of citizens was such a big part of our report, it's interesting that I can go to the Internet Archive, I can provide a website to be saved via their Save Page Now function. Here I saved the Eventbrite invitation for this event. And it makes you wonder, can we do something here? Can we have a crowdsourced archive of COVID-19 that again ends up in Canada for our use? Facilitate cloud storage in Canada. A lot of institutions are collecting data. It's sitting in servers in the deserts of Utah. If we care about our digital cultural heritage, let's have it here. So to quickly conclude, all of this costs money, but our digital cultural heritage is currently preserved on a shoestring. And so as we rebuild, as we recover from COVID-19, it's going to take these sorts of steps to make sure that we have a robust digital memory to inform our future decisions. So thank you, and really looking forward to our questions and answers that will come.
Thank you very much, Ian. I'm sitting here applauding Everything you're saying, fully agree. I thought that's what we were going to do when we put through that legislation in 1904 or 2004. Sorry, I'm working in another century these days. But we do need that kind of support and vision as to what our electronic archive should look like. That vision hasn't been realized. So thanks to certain cuts, budget cuts made 10, 12 years ago. We can discuss that further somewhere, some other forum. Thank you very much. And we now turn to Cheryl Prescott in Toronto. Cheryl.
Thank you. All right, so thank you so much and for the invitation to participate in this important discussion. Already just hearing the last two speakers, I know that what is possible and the importance of what we need to do to preserve these stories. But before I start, I'm privileged to be sitting here in North York, Ontario, on the traditional territories of the Huron-Wendat, Anishwabic, Chippewa, the Haudenosaunee, and the Mississaugas of the Credit River First Nations. At this time, I'd also like to acknowledge my ancestors of African descent, many of whom were unwilling victims of the transatlantic slave trade. And I'm privileged to be here to have the freedom that I now enjoy because of their hopes and their dreams and energy and the history that has been preserved to tell those stories. So today I'd like to share with you part of the story, I guess, of my local context where our community health center sits and the experiences of the community that we serve throughout this pandemic that has really highlighted and shown the racial and socioeconomic inequities in the communities that have been especially hard hit by the pandemic. And all of this in hopes that we do remember these stories to avoid, as was said earlier, the devastation that continues to plague these communities and others that are similar. So just to situate everyone, the community I speak of is in the northwest part of Toronto, adjacent to York University, for some of you that know Toronto well. And at the center of this community is the Jane Finch community, often characterized very negatively by the media and others as a place rife with violence. But what I know of the community is that it is one of Canada's most diverse communities. It does have a large population of Black residents, mostly Caribbean and African descent, but many that have lived here for many generations. There are newcomers from all parts of the world, speaking over 100 different languages. And there are higher numbers of people living in poverty compared to the Ontario and most likely the Canadian average. It's considered to be an urban inner city neighborhood. So it is also actually a community that is very notable for its activism. It is not unusual to see this, where at the intersection of the Jane and Finch intersection protests, where folks are fighting and constantly looking at ways to improve the lives of those living in the community. This is an old slide, as you can imagine, because at that time they were looking at increasing minimum wage to $10.50. Today, they're fighting to increase minimum wage to $15 an hour, increasing job conditions and safety of residents in the community. So when the pandemic hit, we knew this community, another characteristic of this community is the high prevalence of chronic diseases such as diabetes, heart disease, and asthma. So we knew that folks in this community would be have a higher risk of contracting the disease, not only contracting, but dying of the disease from COVID-19. But again, the social situation of the social circumstances of folks in the community are that they are, many of them, employed in essential jobs where they go to work daily on crowded transit. They're lining up to go at a bus stop. They're in close contact. many of their jobs do not afford them paid sick days. So if they do contract the virus, many will continue to go to work, again, increasing chances of transmission. Those that do contract the virus have trouble self-isolating because many live in the apartment buildings, the crowded spaces due to lack of affordability of maybe larger homes. So we knew that this would be a big issue in this community. And then I think in May, we also saw, the world saw the George Floyd murder, which brought to light to many the pandemic of racism that many continue to face daily. So we knew, again, the importance of data collection. The fact that in other countries, in the UK and the US, we saw data that showed the disproportionate impact on the Black community of the virus. Folks who did contract the virus that were hospitalized and eventually died coming from the Black community. And we're seeing some of that now as we collect more data here in Canada. And this is just a slide, I think, very similar to not a sort of chronology, but how this was, I think, the latest data that we, when I made the slide, was in November 2020, which showed the disproportionate number of cases in the Black community compared to their share of our population, compared to members of the white community who make up a larger share of the population. However, their rates were much lower. Similarly, the disproportionate number of people living at income levels below 50,000, for example, compared to those higher earners who, again, had a smaller share of the infection rates. So the statistics showed us this, added to the story, added to the crowded buses, to the folks going back and forth to work. It was not a surprise. So what did we do? And again, why do we need statistics to be collected? We know that in communities, such as in this northwest part of the city, the diversity of residents, both racially, ethnically, culturally, socioeconomically, we need to have diverse strategies to address the problem, whatever the problem is. In this case, community-based testing was something that we responded with as a community health center, simply because we knew we had to decrease access to testing for those that had to go to work, to many different jobs, and we're not able to book appointments at some of our hospital assessment centers. So we brought testing to the communities. This is a testing that happened in a community housing complex, in a parkette. So, and again, also, we had staff that represented the community. We brought together folks and partners who could communicate and respond to the concerns and needs of the community. As well, we recruited what we call community ambassadors, members of the community who could connect and were trusted by their community members. This is a picture of Dana, one of our community ambassadors, who is trusted amongst her neighbors. We call her an influencer, simply because at the beginning of the pandemic, many members of the community did not believe that there was a pandemic. They did not believe of the WHO declaration of a pandemic. They thought, no, this won't happen here. So they did not go for testing. They did not trust the testing that was available. They thought that this disease and this was a virus manufactured to wipe out the Black community, the poor communities. And this was real. This was being said on the street corners. This was said to our staff, to our community members. So it really took a lot of real engagement with trusted members of the community to overcome some of this and increase our levels of testing within the community itself. And we continue to utilize these strategies with trusted community members, because what we've seen, the devastation and continued impact of the pandemic on this community, are things like inequity in access to digital devices, for virtual care. Now that we're moving into doing so much with access to technology, many of the people in the community do not have access to these tools. So we really need to think through, how do we improve access for those folks? How do we help the community members respond to the constant changes, messaging, and the service providers' fatigue and reduction in programs and services that will continue to exacerbate the mental health needs and other health needs of the community members. Currently, we're engaging in a campaign, especially around increasing confidence in the vaccines. And we're doing so in a way that we hope will encourage community members or shift the narrative with community members in that they are important. They're the center of the care and they deserve the best care. It's not their fault that there is lack of access or there's lack of resources for them. So this is where we are now, especially as the vaccine rollout continues in the community. And I have to say that just in conclusion, just the importance of respecting the community members, the diversity of the community that we collect information from and we work with. So I wanted to end in this slide with this slide, because just to showcase that in the Jane Finch community, there is a research partnership that has formed. It's in partnership with York University and members of the community, because they really do feel that they've been taken advantage of when it comes to research and data collection. So they've come up with principles, guiding principles, which include things like just, that the information needs to take into consideration the concerns of the community, the historical power imbalances within the members of the community. And they want researchers to be really mindful of those power imbalances and to have real accountability to them, to the community, as well as our funders, as many of us do have. So I'm really pleased that the recommendations in this report really does speak to community empowerment, capacity building, and really truly being inclusive of members of Canadian society as we look to honor and preserve the stories and throughout this pandemic, the stories of all Canadians, not only a certain segment of the population. So I'll end there and look forward to any questions you have.
Thank you very much, Cheryl. Just trying to get things organized here. Very much appreciate both your presentation, but also the extraordinary work the Community Health Center is doing in that area of the Black Creek area in Toronto. Much appreciated. Thank you. We now have a few minutes for questions. I see we have one question that is in our Q&A folder. It comes, I see, from Tom Nesmith, a retired professor of archival studies in Manitoba. He says, thank you for a compelling report. My question concerns follow-up on it. How can we best pursue its implementation? The team approach behind the report and seen today on the panel and Zoom technologies offer a way forward towards lobbying policymakers and communities. Do you have further or more specific suggestions? Where's the Royal Society going to go with this? And I toss that out to any member of the panel.
I guess I'll start with, maybe framing it as, a question about where do we go from here? And I wanted to thank you, Cheryl, for illustrating some of that work that you're doing, and I'm hoping that all of that is being preserved, because in my experience looking at 1918-19, it was actually really hard to trace how communities mobilized to protect and help each other and themselves. It was really difficult to trace that. And I hope that doesn't happen in the case of COVID-19. I think, you know, the RSC has been doing as much work as it can do to make the research on many different fronts that it's been supporting publicly available and accessible to people. Like other issues that we're looking at, there are both national, you know, provincial and local implications for policy. And I think it really, I sort of hope that these reports will form the backdrop or a starting point for more local level engagement on the issues. And you know, I also hope to continue doing events like this one. But the report is out there now, and it belongs to everyone, from my perspective. Influencing policymaking is an age-old question in public health and archiving, and you know, in how we move the agenda in a way that we might like to see it move. And you know, in Manitoba, of course, we've had some very specific struggles around communities and archives in recent years. But you know, the RSC can do what it can do, but it really, I think, depends on a broader mobilization, and the Association of Community Archivists is one place to start. But so too is community level work like Black Creek is doing, to try and ensure that, you know, preserving stories isn't necessarily a priority for people who are in the midst of a very difficult experience, but I hope the report puts it on people's agenda a bit more.
Good. Thank you. Any other comments? I know there's one question I'd like to put. Oh, Ian, you? Yeah,
I just very quickly, I mean, to me, it often comes back to, you know, money. It sounds trite, but talking to people as part of this task force and just in my other work in the, you know, community archiving space and digital library space, you know, was the burnout, right? That they felt like they were being asked to do a lot, that there was a monumental amount of collecting and tasks to do. And there was a real community spirit in April and May. And then by the time summer rolled around, there was a sense of exhaustion as they felt like they were doing 150% of their jobs. And so to me, it comes back to recognizing, you know, the nature of our historical record has changed. That if we want to have a broadly representative historic record, we need to fund that appropriately. Cultural heritage sector to this, we need dedicated funding.
Yeah, I think just my own career in trying to explain archives to political leaders and hard-nosed budget analysts as to why society should support archives is not an easy task. The stereotypes, the misunderstanding about what we do, the public misunderstanding about the full extent and depth of the resources already available in Canada's 800 or so archives is absolutely extraordinary. Our frustration, it isn't used in the way it could be. Or if we do have the data and the facts and the detail, nobody's looking at it. This can be frustrating. We could take another hour while I tell you some of my anecdotes of talking to politicians about archives and talking, trying to defend budget. That's another day. But I think with the Royal Society and with some of the connections being made here today between the archival community and the healthcare community, there's opportunity here. And I can see some links we could carry on with afterwards. But I see I've got one other question, or Dr. McKenzie, did you want to add something here?
Yeah, okay. I can add when I started working at Wellesley, which was about 7 years ago, I was trying to keep my mental health. And so one of the things I did was, instead of getting a cottage, I invested in a farm. And so I started living on a farm. I was speaking to a guy who's a farmer who runs a farm. And I was trying to explain what I did. And I said, well, you know, I'm at a policy institute. What we do is we grow policies and then we take them out to market. I was trying to make it straightforward, and he looked like he was glazing over. And then he turned around to me and he said, that doesn't make any sense. And I said, what do you mean? He said, well, I'm a farmer and I don't put anything in the ground unless I have a market for it. He says, I just don't plant unless I have a market for it. And I said, okay. And he said, so how do you understand your market before you start? And so because of that, the Wellesley developed this strategy map, which produces 3 types of work. One is the government already doing it. How can we make it better? The second is the government thinking about getting into an area. How can we make it work for equity? And the third is the government aren't there, but we have to say this in order to make sure that the arguments and they don't shrink, to make sure that it stays on the table. And this report is a type, for us, would be considered a type 3 type of work. The government aren't there. It has to be put in the ground. You have to grow it. You have to take it to market. But you know they're not there yet. But what we found is we only get license to do type 3 work if we also do type 2 and type 1 work, and we're considered to be useful. So this is a spectacular report. And the question for me is how one does the other things that start pulling government towards the report, rather than trying to, rather than saying, you know, how do we get this report to market? Well, maybe there isn't a report, maybe there isn't a market for this report, but maybe the next thing can then help move people towards this report. And maybe that's the long-term strategy that we sometimes need to think about. But you'd have done this before because you've worked as the chief archivist, and so you know how government works.
Yeah, it's best if you can link what the archives wants to do to the government priority and direction. Yeah. And we did that many times over the years. Some of it was a stretch, but we did it, and managed from a number of major governments get some serious support. But once in a while you get a government that doesn't listen. And that's the way it is. Because we're talking now, the next question we have, well, this discussion leads directly into it, asking what strategies can archival institutions use, implement to document, retain, and make available the memory of the pandemic when their governing bodies are not willing to provide the resources to devote to it? And I think we're building the whole idea of community interaction, archives based in, rooted in, linked to a community of action. That shows, demonstrates the public support, interest is current. It's not just thinking about documentation for future generations, it's for the present. It's a powerful force. We also find, frankly, genealogists have been one of the most effective lobby groups for archives, not the academic historian. It's been the genealogists who've been able to affect legislative change. In copyright, for example, as I recall, effective legislative change to enable us to move forward. One has to get creative, and I think we've heard some excellent lessons at the community level and community health about creative solutions and responses. Anyway, I'm talking too much. Cheryl, do you want to?
I think just to, just again, going back to the last question and segueing into this question as well, I do think that, I think Juan mentioned this, it's what do we do with the information? And that's what communities want to know. It's not just this should not just be a data gathering exercise. It has to be actioned. And unfortunately, I feel that we have we're talking about history, but we have such a short-term memory when it comes to even what happened last year and our immediate response to this pandemic. Whether that is deliberate, in that it is deliberately excluding the stories of certain members of the community or not, I don't know, I can't say. However, I do think we also have to link this to economics, in that what's happening and the length of our shutdowns and our lockdown, the impact is, it impacts everyone. It's not only those folks living in those communities that are impacted, it's impacting entire societies. And I think these stories need to be told so that we can avoid further devastation. You know, the Spanish flu, what happened there, that taught us some lessons, but they weren't listened to. Again, communities are being ignored. And so for me, I'm just thinking it's the governmental interventions and changes there that needs to happen, but it has to be linked to our economy and the fact that, we are struggling in our entire country. It's not only the folks with the high rates and communities with the high rates, but it's everyone that will be impacted. And hopefully that causes some sort of action.
Yeah, absolutely. And I think I've certainly been impressed by the statistics and charts several of you used in terms of equity, in terms of care and healthcare and community support. These are powerful, powerful demonstrations in use of data. And I've been sitting here wondering, how can we measure equity in our memory institutions, in the documentation that's there? How do we prove there are gaps? We know there are gaps. There are serious gaps in that. How do we prove it in a way that we can use to advance public support and political interest in rounding out and making sure we leave a full record? I think we have a large challenge there. And I've just been wondering, how do we measure equity and equitable, not just access, but representation in the archival record? And that to me is the issue I think that the archival community is wrestling with very actively right now in a number of our seminars and conferences. So, Essel, you wanted to say something?
Well, I was just thinking, the Jane Finch Research Partnership, I think, is one sort of brings the conversation about research to the community level and creates those relationships, or the goal, I guess, is to create relationships of trust and engagement, and also to make research directly relevant in the lives of research subjects, and to create all of those things around governance and safety and respect and so on. And I think that often, a partnership like that could form a basis, as Kwam said, for a vision for archives and historians going forward. And, I also wonder, again, the extent to which the research that's done as part of the research partnership will be archived. Because many of us as scholars, when we do community-based research, our ethical review procedures preclude the long-term survival of our research data, because often the default position is the destruction of that data. And that's the section of the report that deals specifically with guidelines, ethical guidelines around research in tri-council funded research projects, and the need there to provide mechanisms through which researchers will easily be able to navigate the proper procedures around archiving their work, so that it doesn't go from a locked file cabinet in their office to destruction. And the partnership model there could be one way of moving forward with a problem like that.
Yeah, I think we need to find a way to continue this discussion about how do we implement, how do we take some of these ideas that are in the report and move them into action. So this has been very helpful and very useful. I see we have gone a little over time, but I think the discussion was well worth it and well worth putting on the record. And hopefully the Royal Society will preserve this as a record for some long period of time. I think only remains for me to bring this to a conclusion to thank each and every one of you for your participation, your insights, your comments, and frankly, for the work you're doing in the community. That is absolutely essential, and thank you for that. I'd particularly like to thank Dr. Jones and all of the authors and peer reviewers who contributed to the report, as it's outstanding. It really is a first-rate piece of work, and going to be, if we figure out how to use it, can have an impact over the long term. And I just note finally, you've echoed the words of a friend of mine who passed away just a few months ago, Dr. Tom Simons of Trent University. In his report in the mid-1970s about Canadian studies, he said, Canadian archives are the foundation of Canadian studies, and the development of Canadian studies will depend in large measure upon the satisfactory development of Canadian archives resources. It was firm, it was direct, it was cogent, and the title of his report captured really the importance both of Canadian studies and of archives to know ourselves. If you want to know ourselves, you need to know where we've come from, who we are, what we've done together, our failures, our achievements as a society, as we plan and look to the future. That's the fundamental basis of planning. Strengths, weaknesses, that's what you get by understanding the history, by looking in detail at who we are, honestly, directly, understanding we've done some good things, we've also had some failures. And on that note, I think I will bring this to a conclusion. I think the Royal Society report has done great work. Let's see where we take it. Thank you all very much.